Hello, my name is Nicholas Askins, and this is my presentation on femoroacetabular impingement and its prevalence in ice hockey athletes. So, femoroacetabular impingement, or FAI, is the failure of the mechanical processes of one's hip due to contact between their femoral head and the acetabulum of their hip. I became interested in this subject during my evaluation of lower extremity injuries course, as my professor introduced it to me when I complained of hip pain. As an ice hockey athlete myself, I was shocked to learn actually how prevalent this injury was. Through my review of literature, I was able to find that it affects adult and youth athletes at a similar rate. In one particular study, 68% of youth players assessed were positive for FAI-related deformities. Similar results were yielded when we look at adult athletes as well. In a study on 130 NHL athletes, 69.4% of them were positive for FAI. Further review of literature supports that FAI incidences in an asymptomatic population are around 15%. So this supports that FAI occurs more frequently in ice hockey athletes. For youth athletes, I believe themselves and their parents should focus on educating themselves on these symptoms. Any symptoms experienced by your youth athlete should not be passed off as soreness and should see a doctor for examination immediately if it's consistent. The same thing goes for adult athletes. The focus should be on education here. Again, any symptoms experienced consistently are worth a visit to the doctor, especially with such a large percentage of ice hockey players being diagnosed with FAIs. Now, when we talk about future experiments, I believe the focus should be on prevention of FAIs. We could put in preventative screening measures that would allow us to identify patients with characteristics that would put them at risk for FAI. Subsequently, we could perform interventions to adapt that individual to their range of motion as well as prevent any future impingements. There's a lot of promise in the field of biomechanical remediation as well in terms of preventing joint conditions in athletes, so more research should be done in this field in terms of FAI as well. Thank you for your time and have a good one.